Hospitals, the family business of healthcare and medical education. We provide services through 17 of our units spread over 9 districts in Rajasthan, serving more than 29,000 patients monthly with over 510 dedicated as well as well-trained staff members. We have shown significant growth in our industry owing to the focus on sustainable development by developing fresh and young teams, low income but high volume patients. In our language, we call them the bottom of pyramid, and quality centered approach. We as a group have time and again brought radical change in Rajasthan in not just our core field of healthcare, but in the allied fields of sports and wellness. With numerous firsts over our last 37 years, since the group was established in 1986, like the first CT scan, like the first MR in private hospitals way back in 1990s. Our main achievement came in 2012 when we brought not just the best in the world, but at the most affordable price in the world. Today, in 2022, yes, 10th September 2022, I can proudly share we are at the cusp of something that shall again shake the very foundations of how we provide treatment to our patients. With AI, we've all heard of artificial intelligence. Yes, you heard it right. With AI-powered imaging and spectral CT scanning, we will show you real magic can be done now. But again, and I want to stress this again, at the lowest prices possible. In fact, bringing the best in the world to India, to Rajasthan, to our very own SMS Hospital. We definitely got the specifications to install these machines, and we could have passed by putting the bare minimum. But as our founder, Dr. Soni, chairman for Soni Group, has always pushed barriers, we got the best and latest in our city. Now I would like to start off this evening, if I can request Mr. Mohit Soni, if he can escort Dr. Rajiv Bagrata sir, Principal and Controller, SMS Medical College and Hospitals, to the dais. If next I can request Mr. Naveen Sanghi sir, if he can escort Dr. Achal Sharma sir, Medical Superintendent, SMS Hospital, to the dais, please. Now, if I can request the pink power in the family, if I can request Ms. Prerna Malhotra Soni to please escort Dr. Kuldeep Mehndiratta sir, Head of Department of Radio Diagnosis, SMS Medical College, to the stage, please. If I can now request Mr. Amey Feldesai, lead from G team, if you can escort Dr. Soni, Chairman Soni Group of Hospitals, to the dais, please. If I can now request Mr. Harish Bhargav, our partner in Soni Diagnostics, in our Seeker and Pali project, if you can escort Mr. Shrikant Surya Narayan, Head Imaging, GE Healthcare, South Asia, to the dais, please. If I can request the backstage team to help me with the welcome planters. If I can request Dr. Soni sir to please start off this and welcome everybody to the dais. So if I can request Dr. Soni to welcome Dr. Rajiv Bagrata sir with a green planter. ट्रे आप लोगे? Yes, thank you. If I can now request Mohit Soni, if you can please present a planter to Dr. Achal Sharma, sir. Thank you, Prerna, for being prompt. If I can request Prerna to please welcome Dr. Kuldeep Mehti sir with the planter. If I can request Naveen Bhaiya, Naveen sir, to welcome Mr. Shrikant Surya Narayanan from GE with a planter. Ame sir, are you there or should I catch somebody else from the GE team? Great. We like the energy the GE team brings to the table. If I can request Ame sir to please welcome our chairman to the dais with the planter. Planter, please. Planter. Ame sir, we have a surprise for you. So, if I can request Colonel Gharsi sir, if we can have a planter for Mr. Ame Desai from the GE team. I know sir, but we thought we'd, GE is executing the project with us in this endeavor. Colonel Gharsi sir, udhar hi karna hai on the, Colonel Gharsi sir? Sir, on the, below the stage hi karna hai sir. स्टेज के नीचे करना है सर वहाँ पे. थैंक यू. Sir, this is a small token for the whole GE team. If I can request the dignitaries on the dais, we can do the lamp lighting so that we can begin with the whole function. If I can request the backstage team to please bring candles. If I can request Prerna, Neha ma'am from the family to join in. Naveen Bhaiya, please. Uncle. Umrao uncle. Oh, sorry. That's what I was. If I can request Dr. Anju Soni ma'am also to come on stage. Sorry. GP. पीछे guys. Balveer. Thank you, sir. Thank you. The pin drop silence is testament to the fact that we are ready for the session. So, with much further ado, without much further ado, we learn from our private lives that the best way to start is starting from the basics, the ABCs in our life. So, we would first like to welcome Mr. Shrikant Suryanarayanan from GE Healthcare so that he can set the stage today for us to understand the technology and the machines that have enabled us today and that have given us the opportunity to all collect on this hall what magic we can create through technology and through these machines. So if I can request Shrikant Suryanarayan sir to please take the first session forward.
Good evening, everyone. My name is Shrikant. I head the imaging business for South Asia for Wipro GE Healthcare. Pleasure for me to be here. Just a few quick words on GE Healthcare and the amazing partnership that we have with Soni Hospital Group. We've been in India for more than 100 years now. Definitely, very much part of India's growth in multiple sectors, including healthcare. The Wipro GE Healthcare joint venture has been around for more than 30 years. Pioneer in a lot of areas, including R&D and manufacturing. We set up our manufacturing facility in Bangalore, more than 30 years back, where very, very proud to be part of the Make in India, the wave that is now sweeping through the country, and we were the pioneers in that area. Manufacturing today both 16 slice and 128 slice CT scanners. We make PET CT scanners. We make MRIs. We now have started making cath labs as well. And of course, we do continue to make X-rays and ultrasound machines. So this a new facility, which is again very unique, one of its kind, is an all-women shop floor that is set up in Bangalore to make some very high-end equipment for our customers, both in India and around the world. And this facility is under the Government of India initiative around production link incentive, Atmanirbhar Bharat, initiative. So very, very proud for us to be partnering with healthcare service providers such as Soni Group, and also providing latest technology to our customers in India. We also have the largest R&D facility outside of the United States in Bangalore. This center is also more than 20 years old. This is where I started my career in GE. A large group of scientists with cuts across electrical, mechanical. We are the global hub for AI. So a lot of the leading edge AI work, which now many of it that you're using here, at SMS, a lot of the work contribution came from our R&D center in Bangalore. So we are the global AI hub. We recently inaugurated the world's first 5G lab for innovation in healthcare. So again, one of its kind around the world. So again, with the aim of bringing the latest technologies, develop it in India and bring it to patients and radiologists and clinicians in this country, and of course from here, obviously goes out to the world as well. So, clearly pioneers in manufacturing, R&D, AI, etc. So it's in that sense that, the partnership with Soni Group of Hospitals is truly a peer-to-peer partnership. Soni Group of Hospitals is also a pioneer in healthcare, among the first to set up CT, MRI, lithoscopy, etc. Again, a big player in the PPP, just like we have been a pioneer in the PPP space. This group has also been a pioneer in the PPP space as well, and serving a lot of patients affordable, high quality care in the state of Rajasthan and beyond. So great partnership. So we are here obviously very proud to talk about some of our cutting edge technologies that have been installed and been at use now for several months now at SMS Jaipur. And my team will be talking about a few very specific examples in the area of CT, in the area of MR. In CT, we'll talk about some very cutting edge technologies around spectral imaging. And MR, we're going to be talking about some very cutting edge AI technology, what is called as Air Recon DL, bringing a lot of benefits both to the patients as well as the clinicians and the radiologists. So you'll hear a lot more from my team on these technologies that are now, we are obviously very proud to offer it to SMS Jaipur via Soni Group. So again, once again, thank you very much, for the opportunity to be here, and really cherish the partnership, and wishing everyone a lot of success, and obviously delivering some very high quality care for the patients of Rajasthan and beyond. Thank you very much.
So we say that there are casualties in the hospital. That's not the reality. With the kind of rains we are seeing in India today, we have casualties across India. One of our casualties is Dr. Shravanan, who's head at GE Healthcare South Asia. He couldn't make it because Bangalore is swimming to work today. So he couldn't swim to Jaipur. That was the reason why we have a small special video message from him. Because as it's always great to hear a visionary leader talk about what he wants to and how he wants to contribute to the society, especially in this field of healthcare in India and now in Rajasthan. So if I can request the, yeah.
Dr. Shravan Subramaniam, MD from Wipro, and here to wish the Soni family the very best for this amazing enterprise. Due to a personal situation, I'm not able to be there in person, but my spirit is very much there, along with my team from GE, that's offering all their support for the success of this enterprise. This is a story of two A's, access and AI. Between the Soni Group and SMS Hospital, lakhs of patients have benefited from their medical services and their attention to detail. AI, some of the latest technology, has been deployed for this initiative, such as Air Recon DL, that allows us to enhance the workflow while keeping the quality of the images at very best to improve patient outcomes. Thank you very much for this opportunity and assuring you of all the support to take this to greater and greater heights. Namaste.
Thank you. A leader is best when people barely know he exists. When his work is done, his aim fulfilled, they will say, "We did it ourselves." Such a person is the one who I'm going to request next. A humble soul, Dr. Achal Sharma sir. If we can request you to please share a small message to the audience today. Just a moment, he'd already told me before, and he was dealing an emergency there. Sir, I did a quote, I'll repeat it. A leader is best when people barely know he exists. When his work is done, his aim fulfilled, they will say, "We did it ourselves." Such a humble soul. If I can request Dr. Achal sir to give a small message to the crowd today. Sir.
Respected Principal Sir, Dr. Kuldeep Mehndita, Head of Department of Radio Diagnosis, SMS Medical College, Dr. B.R. Soni Sir, Dr. Subramaniam. On the behalf of SMS Hospital, first of all, I say that there is a lot of patients who are waiting for the CT scan and MRI. There is huge crowd, and The upgradation of the imaging technique definitely would cover and all the investigative part of the patients. So this machine would definitely will good more and more better results with a faster and short period of time and give the support to our center. I remember that in initial period of SMS Hospital, we had a single slice and then 128 slice CT scanner when there were a lot of time to be taken for the CT scan of a patient. Particularly because I am a neurosurgeon to the brain patient, head injury patient, and the patient suffering the brain tumor, where the patient is irritable. It's what very difficult to take the imaging with a good quality. But after that, because of the PPP partnerships from the Soni Vardhaman Group and later on with the Soni Hospitals Private Limited, we could achieve better imaging regarding MRI and the CT scan. And nowadays, if I talk about the number of patient, I think from the February to the August, Soni Hospital Private Limited could do more than 6,000 MRI and more than 1 lakh CT scan during that short period. And for that, I must congratulate the Soni Hospital. Looking to the all government schemes to help the poor patients, this load of the patient tremendously increased in last few days. And for that, these types of the achievements or the better machines would definitely overcome our problem so that we can do more and more investigative part of a patient. So I thank to Soni Hospitals and Wipro for providing such an excellent machine to us. We are also associated with the Wipro for the DSA machine in our neurosurgical department recently launched. So directly through that part and indirectly from through the Soni Hospital, we are somehow connected to the Wipro part. Thank you. Thank you for inviting me also.
Thank you, sir. If I can now request our visionary leader, our chairman for Soni Group, Dr. Soni, if you could give us a small inspirational message about this journey into PPP and diagnostics.
Dr. Bakratta, Dr. Achal Sharma, Dr. Mehndi Ratta, G representative, Mr. Shrikant, fellow colleagues, I am indeed proud of what SMS has done for radiology and for diagnostics in Jaipur. I know very well that in 2012, when a tender came out for CT&MRI and we participated in it, we never anticipated how good and how many patients would benefit out of it. I have only one thing to say. When we started, we were doing 200, 300 cases, but in a span of 5-6 years, we reached to 600 cases. And on top machines and with 24 hours working. So patients who came with serious injuries and serious requirements, even at night, were provided with this kind of facility by the SMS faculties and by the SMS records. Of course, we did help them in getting these things done, but it's an effort on part of all my fellow colleagues who have done it. Today, we have put in 5-6 machines in SMS, 1 machine outside and 5 in SMS, and we are running at full capacity, and we're doing more than 800 CT&MRs in a day, which is, this center in SMS is one of the best, not only in India but in Southeast Asia, as told to me by GE. As far as GE is concerned, they've done a very good job in this installation. I know because we started with Philips in 2012, but this time GE came in and they have done a wonderful job with the latest machines. So what we are having here is not even present in large institutions like All India Institutes in Delhi and all that. So we should be proud of our seniors here, whether it's the principal or whether it's the head of department radiology, to have provided such kind of machines in Jaipur. And I have no hesitation in saying Mr. Kuldeep Mendiratta has done a lot of coordination work for this, and his predecessor, Dr. Mrs. Meenu Bakratta, who also planned what we have been able to achieve today. So I thank everybody for whatever they've done, and I wish that we've got good 10 years, we'll be able to provide lot of scientific knowledge to the youngsters who are being taught at SMS, and also provide lot of incentives to people to come and get their diagnostics done at SMS and not outside. And I have no hesitation in saying that these coming of these machines has, enhanced the reputation of diagnostic healthcare, especially radiology in SMS. And I am proud of all the doctors and all the technicians who are doing the job. And I once again, on behalf of Soni Group, thank all for the cooperation done, and we'll try and give the best possible in this field. Thank you.
Thank you, sir. It is the ability to bring out the best in others that makes you a leader. Whether it was on a cricket field, or whether it is in the cath lab room, or whether it is in the OPD chamber, he is making sure that the best is delivered through his own efforts or with his team. If I can now request our dynamic leader, Dr. Rajiv Bagratta sir, Principal and Controller, SMS Medical College and Attached Hospitals, to please give us some words of encouragement going forward in this project.
Good evening. Dr. Vimal Soni, Chairman, Soni Group of Hospitals. Dr. Kuldeep Mendiratta, sir, Head of the Department of Radio Diagnosis. Dr. Achal Sharma, my colleague and Medical Superintendent of SMS Hospital, and Mr. Shrikant. If I can label today's evening as from financial viability to academic viability, I think that will be the right philosophy behind today's evening. All these years, with the go-getter spirit of Dr. Soni, the public which is flocking to SMS Hospital is taking advantage, and rightly so, by being provided services at their doorstep. I can vouch for this because I know even in a hospital, in a public hospital in the capital of the country, such huge numbers are not being catered to. In fact, the waiting list is so high, so long there, that one cannot imagine. But here, with the advent of this public-private partnership, with none other than Soni Hospital, we have been able to provide services to patients in unimaginable timeline. That's the first part of it. Now, in fact, GE has come up with such a good innovative technique, which has been brought, I suppose, probably for the first time in the government institution in Rajasthan. And that has set the ball rolling, with the result that the GE has been able to provide not only 1, 2, but 3 machines in SMS Hospital itself. So, in fact, in the next 1 month or so, we shall be starting our cath lab also, which has been provided by GE. So, and the credit goes to obviously the Soni group of hospitals, which set the ball rolling. I also understand that sessions like today will go a long way in utilizing the specifications which have been so astutely and painstakingly prepared for such type of setup in SMS. Not only now we'll be catering to the run-of-the-mill type of patients, their diagnosis, but with such type of application updates, we will be able to step up our knowledge regarding those specifications and be able to use all that is available with such innovative techniques, and that too in SMS. So I thank Dr. Soni and the GE. Their collaboration, I hope, will go a long way to not only get services to the people of the state, but also to improve the academic environment at SMS, so that the students who are coming to study here to take their knowledge ahead will benefit. Thank you.
Thank you, sir. Thank you. Very aptly put that we should never forget that we are serving our patients, but we also have students there who are the next in line to ensure that the care continues. And they are also equally important in this journey of healthcare. With this, we'd be coming an end to our first part of our evening session today, which is a small inauguration we had planned for this academic CME. If I can now request if I can request team members from our team to felicitate the dignitaries on stage so that we can close off the first session. If I can now request Mohit Soni, Executive Director at Soni Hospitals, if you can please provide a small memento and a gift to Dr. Rajiv Bagrata sir for sparing his valuable time today. If I can request Naveen sir to present a small memento and a gift to Dr. Achal Sharma sir, Medical Superintendent at SMS Medical College, and SMS Hospital. If I can now request Prerna Malhotra Soni, Associate Director at Soni Group of Hospitals, if she can present a small memento to Dr. Kuldeep Mendirata sir, memento and gift from our side. If I can request Harish Bhargav sir from the Soni team, if he can provide a small memento to Mr. Shrikant Suryanarayanan, Head Imaging at GA Healthcare, a memento and a gift from our side. So if I can request our clinical team, Dr. Bagrata, Dr. Achal sir and Dr. Kuldeep sir to be please seated on the dais. We'd be requesting the other dignitaries to come on the VIP rows in the first row so that we can move to the second session, the academic session. I think everybody, okay, so. Perfect sir. Definitely looking at a 50-inch screen and a 200-inch screen, there's a difference, so I agree. It is my privilege now. If we can start off with a small applause to the first session that is gone. A little bit of applause. I think we need a little bit of energy also in the room when we start our academic session. So if we can start off with the first academic session. This is, if I can welcome Mr. R.K. Sundar, General Manager Imaging, Clinical Partners, GE Healthcare South Asia, for the first session. He is an alumnus of Trivandrum Medical College, where he completed his diploma in radiology technology and did his post-graduation in imaging sciences from the renowned Sri Chitra Tribunal Institute of Medical Science and Technology. He has been working with GE Healthcare for the past 2 decades and been a key contributor in developing new CT scanners and algorithm in reconstruction and post-processing. His interest includes development of visualization tools and using AI in CT reconstruction. Today he will brief us on the usage of spectral imaging using dual energy in various clinical applications in head-to-toe routine imaging in CT scan. This is the unique facility that we have in SMS that he'll be sharing. And over to Mr. Sundar sir for the next session.
Thank you, sir, for the warm welcome. And once again, a very warm welcome to all the dignitaries here, all the clinicians here. Great story about the strong machine, maybe the world's fastest CT scanner being installed in SMS Jaipur, and the team enabled this fabulous achievement to serve the needy at a very low cost, as well as one thing Shravan was telling, the reach which we are able to make with this system and the clinical abilities. It's my job to take you through what is called spectral imaging in a nutshell, and in various clinical scenarios, how this can be a differentiator in bringing out the clinical outcome in a most useful way with high degree of specificity. So that's why I put the slide, the starting slide itself as revolutionizing CT. And of course, if you read bottom, I put one more line there, see the unseen. So we'll be taking some comparison where spectral CT was able to see something which a normal CT was not able to see. So with that, I start the presentation. Few things which had been always there in mind when you are doing CT scan: how fast it can scan, how much is the detector coverage, whether it can do cardiac very well with something called temporal resolution. Revolution CT, what is installed here, may be India's second system to install to be here, and first system in a government institution is here in SMS Jaipur, that is the Revolution CT. Really, as the name implicates, it's a revolution in CT imaging. There are so many things that are there inside. I'm not taking you through this technological thing, but one thing which I want to tell is the fastest scanner, a 512 slice CT scanner with dual energy spectral capability, which has very powerful tube data transfer system, and more interestingly, this contains real gemstone as the detector material. That makes the CT completely different. It is gemstone inside. So we call this as gemstone CT as well. So those who have not seen the CT at the installed place, this is how the CT is, and this rotates at a speed of 0.28 seconds. So almost like more than 5 times in a second. That's the speed at which the gantry rotates. The force of that is above the speed of a rocket which escapes to the space. So this is the speed at which we are slicing the whole body, and that enables us various clinical application. One of the most important clinical application is in cardiac imaging using gemstone CT. In cardiac imaging, what you need is high resolution, very high resolution, so that you can see small lesions in coronary vessels, which are typically 2 to 3 millimeter, and the lesions are much smaller. So what you need is a very high resolution, and gemstone CT, unlike the other normal CTs, which are also there called 256 or 512, gemstone CT gives you 230 microns or 0.23 millimeter of spatial resolution. That means you can see structures as small as 0.23 millimeter. We achieve it by this revolutionizing technology of gemstone detector and a clarity imaging chain. Getting into cardiac imaging, irrespective of the heart rate, whether it's a low heart rate, high heart rate, variable heart rate, or if there is an arrhythmia, the system can do the whole heart in 1 or maybe in 2 beats. 2 beats, that's all the time required. And also, completely the procedure is non-invasive, and the beneficiaries are those patients who all are at high risk in developing a cardiac disease, or anyone typically above the age of 45, what we call as high risk category. So hypolipidemia, diabetes, family history, these are all the indications of having a cardiac CT done. It is a simple screening procedure. Of course, it involves use of contrast media, but at very low radiation doses, equal to that of almost like I can say almost 1/6 the dose of normal coronary angiogram in cath lab. So it is a great tool to look at the heart. And many of the dignitaries have been beneficiaries of this technology being used so that they can detect early cardiac disease and go for an appropriate treatment. As a case which is in front of you is a patient with a mixed plaque. You can very well see a small calcified plaque there, and the depth or the detail in which you can see all the coronary vessels to the distal branches. That's what I called it as 230 microns or HD resolution. You can not only stop this scanning with the heart, you can also extend that to look at the carotids and look at the intracranial vessels also, because cardiovascular disease are always classified as this is a disease which involves the 2 critical organs, the heart and the brain. So you can, with the same injection of contrast media, you can look at both coronaries and you can look at the brain as well in a single setting, and completely non-invasive, a coffee time or a tea time procedure. That's all it is. Maybe some patients who is having symptomatic and who is there on the disease, but we want to assess whether a stent need to be put, whether the plaque is vulnerable plaque, whether it is calcified plaque. Here is a case where you see HD high definition imaging is used to look at the plaque here in the right coronary vessel. You can beautifully see the black colored soft plaque as well as the calcified plaque around. And this specific view is very specific to G, is called IVUS view, virtual IVUS view. You can see the lumen and you can see the plaque very well. Many times, when you look at the heart coronaries, we want to look at what is the status of myocardium. That makes more important decision in terms of treating the patient. Here we have facility to do myocardial perfusion and look at the viability of the myocardial or remaining myocardium, whether this need a treatment or some kind of a conservative management. As I said earlier, heart rate doesn't make any issue for us. It's a walk-in. Here you see an example of patient who is having heart rate almost like 56 to 109 BPM, and look at the image quality what the system has produced. This is why when I started, it's a very fast rotating scanner that makes this essential requirement fulfilled even for such challenging patients. When we have spoken about using CT scan, there had been always a question what you will do for the pediatric patient. A system which is faster need to be kind to the pediatric patient. That's what we have realized with Revolution CT. Usage of low kV, low energy, will enable very low radiation dose to the pediatric patient. That's one of the highlights of the scanner. So we have seen high definition imaging all across different part of the body. Now we'll see some example in neuro. There is a right MCA occlusion. You can see the red arrow there, and the reason being the right carotid. You can see at the bulb level, there is a mixed plaque formation that probably has moved up and created this. Sometimes you get CT scan for patients who are having metallic implants, and it's very difficult to see the structures below this or in its vicinity or in adnexa with the metal implant, they create a lot of artifacts in CT. We have a great solution called Smart MAR with spectral, will enable you to see the structures. You can see two pictures here. One is without metal artifact reduction and the other one is with metal artifact. So it clearly removes the metallic artifacts from the implants. Now we'll get into spectral CT. Spectral CT, how this is being heard is a CT which will make you to see the unseen. I put two images in front of you. This is done on a normal CT, a renal cyst. Renal cyst, as you know, is water. Cyst is nothing but water component, which has a Hounsfield unit or CT number of 0. But the moment you are given contrast, cyst should not enhance, right? But on a normal CT, you have seen the cyst is increasing its Hounsfield unit. That means, is it a tumor or a cyst? This is what today's problem with the current routine CTs, whereas spectral CT can now clearly say which material it is, whether it is tumor or whether it is cyst, very clearly. That's why we say this is CT, spectral CT is more sensitive and it's more specific in identifying non-conspicuous small lesions. There are multiple technologies are there in dual energy imaging, and spectral CT ranks the highest in it, and this is also called fast KV gemstone spectral imaging. How this is done? You have an X-ray tube and the detector there. The detector, as I told earlier, is gemstone detector, and the X-ray tube fires the X-ray very fast at two energies, 80 and 140 kVs. And with that, once you are done your scan, you get the result. And very interestingly, when you're doing a spectral imaging, many times you need not have to, you need not have to do the plain scan. You can directly get patient scan with contrast and get plain scan out of this. That makes the radiation dose almost goes by half compared to a normal CT. So many advantages are there. It's one of the advantage. We will see some of them now. Across the body, head to toe, there are so many applications are there. These are the global publications from 2010 to 2017. You can see major applications comes in cardiology, oncology, and in vascular, as well as in orthopedics. Of course, there's a infographics very clearly says which all are the key areas where we'll be focusing across the body. We'll see some of the examples. Let's start with neuro. This patient had undergone an intervention for thrombolysis. When we injected contrast, what has happened? Contrast would have leaked into the interstitium because of the excess volume there, and immediate CT on the cath lab showed a bleed kind of thing. So they were suspecting a bleed. Whether it is contrast or bleed, no one knows. Normal CT cannot differentiate this. We have done a spectral CT and suppressed the iodine, suppressed the contrast. You can see on this image, there is no iodine there, right? That means it is not bleed, it is the leak of contrast which was present as hypodensity in a normal CT image. Now you see the difference between a normal CT to a spectral CT, how it do value addition in definitive diagnosis. A patient who was done with shunt, there was some injury happened. Now we want to see whether contrast is there or how much is the portion of bleed. So you can see the upper image and the lower image. What you see down is blood and iodine suppressed. You can see the volume of blood leaked, and the top image shows both blood and the contrast together. So you are able to differentiate different material even though they appear as white in a normal CT. So that's why we call spectral CT is material specific. Here is a case where you have basilar top aneurysm being coiled, and what the neurosurgeon wants to see is whether there is remaining aneurysm or not. In normal CT, it's very difficult to see. You are seeing little bit artifact there and you are not able to make out any aneurysm. But the moment you are gone for spectral CT, you are able to clearly see the coil and the amount of aneurysm there, the remaining aneurysm. This is one of the good application which I have seen. Do a single scan with contrast and you get the plain scan out of this with accurate Hounsfield unit measurement. And this is called virtual non-contrast imaging. The advantage is that you do the scan with half the dose and half the time. So patient benefit in terms of both renal, those patients who are having renal compromise, you can reduce the contrast volume. Second, you can get the plain scan from that, so the radiation dose is also reduced, and overall time is reduced for the patient on the CT bed. So you see on the top is the normal contrast image. What you see here is a virtual non-contrast image created from the images in the top row. A carotid plaque. Now we want to see how much is the remaining lumen here. And there is a method to suppress the calcium and show the lumen alone. Now it's very clear for us, with the calcium and the lumen together, you will not be able to make out how much is the remaining lumen, but with the material suppressed calcium, we are able to see the lumen versus the remaining, the suppressed calcium. A patient with acute chest pain, nothing was suspected, nothing was actually much visible on a routine CT, and what we were able to see is intramural thrombus, which you can see with the arrowhead. So here we have done blood imaging, iodine suppressed. Pulmonary thrombus imaging. In any normal CT, you will be able to easily make out pulmonary thrombus. It's easily visible. What spectral CT can give beyond it is, it can give you iodine perfusion of the lung. That shows the functional lung volume clearly. What will be the patient prognosis? Or during the therapy itself, you can have a follow-up and say how much the patient has progressed visually, not only seeing the thrombus, but also visualizing the amount of lung return to the normal perfusion. Here's the patient who had 7 days of treatment and a follow-up scan, and we were able to pick up those areas where there is no perfusion. You can see them as black areas, and the normal perfused areas are in blue. That's because of the fibrosed lung, which is not responding, right? So whether to continue the treatment, or you can happily discharge the patient if the patient is functionally doing well. So this decision can be made out from spectral imaging. A female patient who came with abdominal pain, and she had breast lump being detected clinically. We have done a spectral imaging. Of course, breast imaging is not yet established as a strong modality with CT, but we have done a breast scanning along with the abdomen. So we are able to see a breast lump there, and the periphery of the lump is having high iodine, and the center is necrotic. So we want to see whether it is what necrosis it is. This clearly says a negative curve on the spectral analysis, which says that it is fatty necrosis. Whereas on a normal CT, it will be very difficult to say whether it is fat or whether it is because of water exudate. The same patient, we have done small lesion detection using a very specific AI-based software, and this is called lung Vicar. This will help you to highlight the lung nodules very easily. And in the same patient, you can see a small liver lesion with again a central hypodensity, and the central hypodensity is fat necrosed, periphery is enhancing. So breast metastasis to the liver. This one is a contrast image on a normal CT, 120 kVp image, and no lesion was detected in this cirrhotic patient. The moment you have turned on the spectral mode, we are able to see enhancing rim there, and on iodine map, you are able to clearly see the small lesion there. So otherwise, you would have happily missed it on a normal CT. Young patient, 34-year-old, with elevated enzyme level. Normal CT was showing something doubtful, maybe a vascular shadow, we thought, but the moment we did gone for the spectral analysis, we were able to pick up multiple small dots there, which are all enhancing, multinodular HCC, and the vascular image showed corkscrew vessels, which is a clear indicator of what we are encountering with. When you have patients who have undergone, say, RF ablation, we want to see how much is the progress of the patient over a period of time. Here, this is the initial scan, and you can see in the iodine map, well-seen lesion, and these are the follow-up scan on spectral CT, which says no iodine or minimal iodine enhancement. So that means the patient is well responding to your RF ablation, which is normally not visualized on a routine CT. This is another case where they have done TACE, not RF ablation, TACE. So you see on a normal CT image, you are not able to pick up any lesion, but when you have gone for a monochromatic spectral imaging, we were able to clearly pick up the small enhancing nodular lesion there. So the entire diagnosis changes, and the treatment pathway for the patient changes. A patient with Gallbladder perfusion, you can now see the clearly opened gallbladder and the gap there with a spectral image. And the same patient had hypoperfusion of sigmoid loop. So usually these areas are unseen on a normal CT because enhancement changes are not easily appreciable on bowel on a normal CT, whereas spectral CT with iodine imaging will help you. We'll see some inflammatory bowel disease. This patient had some bowel problems, so we have done a CT. So you can clearly see the enhanced portion of the cecum there with bright enhancement at monochromatic images, whereas a normal image will be looked like this. So you can see how spectral imaging makes the difference in efficient diagnosis. This patient, an old age person who came with ischemic colitis, diagnosed elsewhere, then we did a CT angio which shows the IMA thrombus, and then we have gone for bowel imaging with spectral, and you can see no enhancement of large portion of the colonic wall. When we did a follow-up after 5 days to do, because he developed a left leg pain, and we were able to, right leg pain, and we were able to see a thrombus inside aorta, and that was dislodged to the lower extremity. So the patient had a thrombus in aorta which got dislodged. So we have done multiple diagnoses using spectral imaging there. Another case of ischemic colitis, normal image looks very difficult to interpret. The moment you are gone for spectral image, you can see no bowel, large volume of the bowel is unenhanced. So that is the power of spectral imaging. Another area where spectral imaging makes a difference is in GI bleeds. Very difficult to identify small bleeds, but the moment you go for something called iodine image, you can see pooling of contrast in the bowel. And of course, here you are able to track the vessel also, and whatever marked in red color is the bleed. And in the spectral image, you can see it's well highlighted. So you know the site of bleed, you know which vessel is causing the leak. A patient with multiple things inside, gallbladder shows something like a stone, so we created a fat image. It shows negative curve, confirming that it's a fatty calculus in the gallbladder. The same patient had intensely enhancing gist, showing high degree of contrast enhancement. And of course, she had something more here in the left kidney. We didn't know really what is this. The moment you put an ROI, it showed a fatty curve. So that is nothing but angiomyolipoma. So how specific spectral CT can be. In your routine case, when you're reading the image, you can make the difference of what this is. Rather than simply telling it's a cyst, you can now confidently say it is an angiomyolipoma. This case was more challenging. Suspected enhancement. Really, if you look at this image, you are not able to see any enhancement here. Rather, it's looked like almost like a cystic thing with a pseudo enhancement. The moment you put a spectral curve ROI, you show the positive curve, upward curve, which says that that's an enhancing lesion. So the entire diagnosis changed from hyperdense non or benign liver lesion, renal lesion to a renal mass. So that's a specificity of spectral imaging. There's a case where follow-up scan on prostate, you can see the central enhancing zone of the lesion, which is usually not seen on routine images, whereas spectral CT was able to pick it up well. A patient who presented with suspected renal mass, when we did multi-phase spectral images, we were able to pick up areas of low perfusion. They're not brightly perfusing. What you see in yellow color is normal kidney, whereas what you see in the blue color is the non-perfusing area of the kidney, which clearly says that this, what you are encountering is not a renal mass, rather it is renal abscess. So what happens when you have renal mass? Renal mass will look something like this. This patient has a renal mass. You see bright contrast enhancement in the iodine map, and you see the vascularity there, the blood vessel descending into that. So this is what the spectral CT will give very specific on the cases. Of course, as you know, stone imaging, renal stone imaging is very common with spectral CT, where you can differentiate different type of stone, whether it is bruchite, whether it is calcium oxalate, monohydrate, dihydrate, or struvite, with specific atomic numbers. There are multiple cases are there. Here you have a case where this one is uric acid, calcium oxalate suppressed, whereas calcium oxalate, uric acid suppressed image, you can see it's bright, which clearly says that this stone is calcium oxalate stone. On a normal CT, it look bright, but it's very difficult to say whether it is calcium oxalate or uric acid. Of course, the treatment differs for different type of stone. So we can be very specific in renal stones as well. In orthopedics, multiple application, one of them is to identify the edema on CT. MR is very sensitive for edema, but in trauma, it's difficult to do MR for a long, because it takes a longer time compared to CT. You can easily identify the edematous place in a CT. You can see the edematous area versus the normal bony area. Same thing in wrist also. I'll show quickly an example. You can see now the edematous area in the wrist very well, which are seen in white color, which is not seen usually on any normal CT. And of course, when you have spoken about the contrast dose, we have seen the radiation dose is less, it's half. We can do very low contrast volume CT also for those patients who are renal compromised. For example, this iotogram was done at 20 ml of contrast with low injection rate, but we have used gemstone spectral imaging and low KEV monochromatic images to create this image. In a normal CT, your image would have been something like this, which is of no use. So spectral imaging also help you to reduce the contrast volume. In peripheral angios, it helps you to see the smaller digital vessels much better using iodine images. So you are able to see most of the vessels very well. When you have heavy calcium, it is very difficult to see the lumen. You can put on spectral imaging there and look at the lumen without the calcium. So that helps you to efficiently look at the volume or the area or the diameter of stenosis at the affected area. Just to summarize, quantitative CT imaging with spectral CT is the great innovation today, which is very specific in terms of identifying, characterizing the lesions with high degree of quantitative specificity and help you to arrive at definitive clinical diagnosis. Once again, thanks to the Soni team as well as the SMS team for giving us this great opportunity to just showcase the technology in front of you. I know that it was very quick. We were able to showcase some cases. Definitely we can have a discussion during the dinner time. Just inviting sir to come and announce for the next session. Thank you so much.
Okay. So we must thank our first speaker. He said we'll take the questions offline so that the evening can go as per our schedule. So if I can now request our next speaker, our next session, which is on session on Air Recon DL. If I can request our speaker, Suresh Joel sir, Senior Product Owner, Artificial Intelligence at Jack Welch Technology Center, Bangalore. He's an engineer from BITS Pilani, our very own BITS Pilani in Rajasthan. He's done his PhD in biomedical engineering from Virginia Commonwealth University, USA. And he's been with GE for nearly a decade. And he's going to be sharing his interest. And his area of interest is AI-based image quality improvements, functional neuroimaging, resting state with fMRI. Over to sir to enlighten us with this new AI-based approach on digital imaging.
about air recon DL. And there has been a lot of talk about this AI technology that improves image quality and gives great pictures and improved clinical value. And today, in the next 20 minutes, I'm going to talk about how this works and how you could possibly use it in the clinic and what improvement you can bring to patient outcome. So what is Air Recon DL? Air Recon DL is a technology that simply does two things. One is it improves the SNR of the image. Second, it improves the resolution of the image. So by doing these two things, we can achieve many more things like reducing time and getting much sharper images. So the whole thing that we need to take today is how we can improve our image quality using this new technology called Air Recon DL. And I'm going to talk about how this works. MR imaging does not produce direct pictures of the body like many other modalities. This produces images in a different domain called the Fourier domain or the frequency domain, and the image looks like this, which doesn't make a lot of sense. And in the MR machine, this image is then filtered and made into something more meaningful by a Fourier transform. And after the image is Fourier transformed, it is further filtered to give what we conventionally get from a MR scanner. So this chain that you see from the scan signal that we get till the final image that we get is a lot of research has gone through this. This is over 30 years of research going from how to improve this going from the left side to the right side. But what has happened in the last few years has transformed the reconstruction process. And here we can see in the traditional method, you will see the image on the left with a lot of ringing. And it is also noisy. And after filtering, you will see the image on the right. You will see the ringing is reduced, but it is still present. And you also see that the edges are blurred. The gray matter, white matter separation is not as sharp as it is in this image. So this is what happens when we use conventional filters. What Air Recon DL does is something transformational or something drastic. So I have been an image analytics scientist who's worked on a lot of these filters for several years. And what happened when AI came in is that it transformed the whole thing. It is actually very exciting to be part of the journey here where this image reconstruction itself is being radically changed from what it used to be before. And we can get images that are much, much better without the loss that we typically see when we used filters. So what does Air Recon DL do? It is a deep learning method which has millions of parameters in it where the data, raw data from the scanner is fed into that and it creates the image output. And this process is learned by the system over thousands of images. It is trained over thousands of images, and this network is trained to produce this image which is void of any of the artifacts that we typically see. And this is the theory. I will also show you some images. Inside, what it does is this is a huge matrix, 100,000 variable matrix, and it is like filling a Sudoku puzzle, right? You solve a Sudoku puzzle, you have 9 squares, and you try to fill value per square. And what you do here is you're doing it over a large range of values on the raw image, and then it is fine-tuned for each contrast, for each region, for each anatomy. It is tuned in a particular way so that it works the best way possible. So like I told you, this deep learning method is trained with images that are got from thousands and thousands of images, all different kinds of contrasts, the biology behind the images that are there, the physics of the acquisition, and all the processes that go through are all modeled within this AI method, which uses all of this information to create artifact-free, noiseless images. So you can see here, this is just a sample image of different resolutions and contrast. And you can see on the left-hand side, the conventional images shows you these dots with what we call as Gibbs ringing, which causes these rings around sharp edges that we have. And it is also blurry. Whereas on the right side, you can see with the air recon DL method that you are able to undo the ringing and also create much sharper images. If you zoom into it, you can see it much better here, that the ringing and the blurring that is seen on the left is no longer seen on the right side. And this is possible only by using air recon DL. Filters worked for 30 years could not produce something like this. Now that we know that air recon DL can produce sharper images with lesser noise, I want to try and talk to you how we can use this. And I'm going to give you an example of cycling. People who are cycling or interested in cycling know about this, right? So if you want to buy a nice cycle that you would like to ride, there are three things that come with it. One is you can get a strong cycle that will not break. You can get a cheap cycle or an expensive cycle. Or the third factor is you can get a heavy cycle or a light cycle. Ideally, you would want a light, cheap, and strong cycle. But you cannot have all three. You can get only two out of the three. You can get a strong, cheap cycle, but it will be very heavy. You can get a cheap, light cycle, but it will not be strong. Or you can get a light and strong cycle, but it will not be cheap. Okay? So this is what we have dealt with in conventional MR. And this is probably also, most of the radiologists and people who work in MR will be able to realize that there are three things that we balance. There is resolution, there is SNR, and then there is scan time. And we can achieve only two of this at any point of time. And this optimization or balance that we do between SNR, scan time, and resolution is what we call protocol optimization, where all the app specialists come, they tell you, you can increase the resolution for this, but you have to do this much scan time, and there is a small window around which we play. And this is what we have done for so long. Now, with Air Recon DL, what is happening is this small area that within which we have to play for protocol optimization has become much, much larger. And this balancing act of finely tuning things is not actually necessary. And this opens up a lot of doors. And in the beginning, we were talking about accessible MR. What we could do with this is you can make things go very, very fast with the same image quality. Or you can improve image quality to an extent where you can see things that were not visible before. Your resolution can improve drastically. You can also try and see how you can make it accessible by making MR scans, do more scans per day and be able to make it affordable in places where it was not affordable before. So this is a game changer in itself. And over the next few slides, I'm going to show you some images where we see this difference in MR images. So this is a knee image. You can see on the left-hand side is the conventional low resolution, high SNR. So when you have bigger voxel size, you get better SNR, and that is what is seen on the left. In the middle, you have a conventional image, which is high resolution. And as soon as you go to high resolution, you can see that the SNR has dropped, and you can see noise in the image. But what Air Recon DL is able to do is take that high resolution scan and give you the SNR even better than what is on the left. So this bounding box by which we had to trade between SNR and resolution is no longer that tight. It has become a lot bigger. If you zoom in, you can clearly see the sharpness increase in the second and the third images and the blurriness in the first image, and the noise level also improving drastically in the third image. This is the same image, but you are doing a trade-off in time instead of resolution. So you can, the second image is a much shorter image, and with Air Recon DL, you can bring back the same SNR, but with a much shorter time. And again, some zoomed in version to show you how this improves. And this is a series of images, and as you go from the top left to the bottom right, you can see that the resolution of the images is getting higher and higher, or the voxel size is becoming smaller and smaller, and because of that, the SNR is increasing as you go further down. And what you will see in the next slide is when we apply air recon DL to this, you can see the SNR improvement. I'm going to switch back and forth to show you the SNR improvement. This was what it looked like before air recon DL, and this is what it looks like with air recon DL. Before and after. You can see how the sharpness is retained and the noise level is reduced. And all of this is done by this deep learning technology. There is also examples of how conspicuity of pathology is improved because of this air recon DL technology. You can see in the pre-contrast and the post-contrast, if you have a 3 mm routine MRI, you don't see the pathology. Whereas when you do it at 1 mm, you can clearly see this. And this is possible only with air recon DL. If you did it at 3 mm, you lose the edges due to the blurriness. But when you do it with 1 mm and then apply air recon DL, it is clear and sharp to give you that conspicuity. The next is a series of images of the spine that will show you how this works, how we apply or how we can protocol optimize in this new age of air recon DL. First, on the left-hand side, it shows a conventional spine scan that takes about almost 3 minutes. It's 2 minutes 49 seconds. One thing that we can do is increase the bandwidth without losing too much of image quality, but you can see that the SNR has gone down, and because of the increase in bandwidth, you're able to make it much shorter. So your scan time now is 1 minute 43 seconds, and it's a little noisy. I can further accelerate this. Instead of doing 2x, I'm just doing 1x with ARC, and it gets to a much faster acquisition, but it is still very noisy. I can further do something, increase the resolution, which further increases the noise. And so right now you have better resolution, almost one third to 1/4 the scan time. And when you apply ARDL to the last image, you get an image quality that is even better than the conventional image that you get with almost 4 minutes. So this is what ARDL can achieve. And this is achieved by trading off between resolution and time and SNR, and you have a lot more room to play with it. So now you can choose between what you want to trade and what you want to improve. This is a zoomed in version of the same spine image showing you that the image quality is very well maintained on the right side. There are lots of patient testimonials where they're able to see things that they weren't able to see before because of air recon DL. This is a testimonial from a radiologist saying that the pituitary gland has never been better in an MR before. You can do this to decrease scan time. Easily anywhere between 30 to 50% reduction in scan time is possible by using air recon DL. So we can get a lot more throughput. This is examples of how much time you can reduce. There are places where 60%, 63% reduction in scan time is possible. To explain how this happens, I'm just going to take probably 5 minutes to explain how this happens. If you think of voxel size increasing, your SNR increases linearly. So if you go up in voxel size, the SNR also increases. The conventional image is the red line, and what we can do with air recon DL is the blue line. So the SNR goes up so much that you have a lot of room to play with. So previously, we could work only within this range, and we had to be above this. So there is a very small area to play with. But right now, you have such a large range to work with where you can use it to either do a faster scan or do higher resolution or to get more clearer images. This is an example, another way to see this with scan time, but I'm going to use this illustration. This shows it a little better. So if you take scan time and volume on 2 axes, you can think of the SNR that is required to be a curve like this. Anything where the volume is high and the scan time is high will lie on that side of the curve, which will give you clinically viable SNR. And anything that is on the left-hand side or the lower left of the red line is not acceptable. This was what was conventionally done. And so this is unacceptable SNR, this is clinically acceptable SNR. And we also had a limit on the scan time because we couldn't have the patient in the scanner forever. And we also need a resolution threshold because we want to see structures that are small. So what we end up having is a small region within which we optimize our protocols to work within that region. And we really can't move too much in SNR or time. Now what has happened with air recon DL is that curve has come down drastically. And because of this, what you can do is you can either heighten your resolution, or you can do it faster, or you could do SNR. So based on what your requirement is, you can tune it to give you better results. So this is an example of a lesion that is visible much clearer with air recon DL than with conventional imaging, where you can barely see anything. And you can see the lesion much better here. Because the noise is removed, the Gibbs ringing is removed, and the image has higher sharpness. So now, given that all these things are to be played with, there is one more thing that we typically let the radiologist decide. So some radiologists would like to see the texture in the tissue while viewing the images. They do not want to see a smooth image. So if there is a parameter in the air recon DL that can be chosen where you can retain the structure in the tissue, or you could clean it up and create a clean image like this. So there is a low, medium, and high tuning parameter that is available with air recon DL as well that can be adjusted to what needs to be done. So there are many parameters that can be tuned to what the clinical need is. If you want faster scan and more throughput, it can be done. If you want better image quality with cleaner images, that can be done. If you want sharper images with higher resolution, that can be done. And all of this is possible with air recon DL. And this is it has been deployed in a lot of places. There is over 300,000 patients, 3 million patients who've been scanned through this ARDL. There are testimonials across the world. Everybody likes it. There is not a single person who says this is not worth the investment. And there are no media that is there. You can scan the QR code if you want, or look at, just search for GE healthcare, and if you look at unmissable, you will be able to get more details on more testimonials from across radiologists who can give you more information on this. And this is also available on the entire line of MR scanners that is there from GE. So all of this is possible. Now, this revolution in imaging that has come with DL is just started. As in, it is started with 2D imaging right now. It is going on to 3D. It is going on to propeller. It will go on to cover all MR scans, and we will be able to do scans 4 times faster, or 4 times higher resolution. Whatever the need is, that can be done because of this AI technology that is available. So there are many anatomies that are there, specialty applications that are in the pipeline that will come up. And this is also to show you the clinical coverage. 99% of MR exams will already benefit from what is available with air recon DL. So I've shown you images. I've shown how things work, why it works, and how you can use it. I also have several images that is from the SMS site here by the Soni scans. And these are examples of the speed and the quality of the images that you can get with this air recon DL. This is a DWI scan with where you can do isotropic reformatting, where you can see a lesion so clearly in all 3 planes. Again, these are all, if you look at the scan times, it is all a minute or 2 minutes at the most. And the FOVs, even with small FOVs, there is clarity is maintained. This is a TMJ joint, again, very high resolution and very short scans. there is spine, and I can have my laptop lying around here if people want to look at the images for each of these. And this is to show that this is not only images that we acquire somewhere in a GE center and show images. This is actually happening in a scan center here in Rajasthan. So I will stop here. If there are questions, we can take, or if you want to, sure, we can take the questions offline. All right, thank you very much.
Thank you, Suresha. Thank you for an amazing session into technology and how MRI and how we can change with, how we can actually utilize the technology now for the patients in a very practical way. Thank you. So, do I have Mr. R.K. Sundar sir here as well? Okay. Yeah, if I can request, thank you once. If I can request both our speakers, R.K. Sundar Saab and Suresh ji, if I can request you on the stage, please. Naveen bhai, if I can request you to please felicitate our speakers today for giving us this knowledge and input into how CT scan and MRI can, how we can do it in this new way and how magic can be created for the patients. If you can do it on the stage, it will be lovely. It's just a small token of appreciation from our side, a small memento. So it can fit in your suitcase. That was our criteria. Well, I know we are running late on the clock, so I'll just end with a statement from one of the widely acknowledged and one of the greatest and most influential physicists of all time, Albert Einstein. Education is not the learning of facts, but the training of mind to think. I hope today's session would help us all take back a few pointers that ensure we can and assure us that we can do everything faster, better, stronger, especially for our patients. And the best part is we have to do it together. So I thank you all for sparing your valuable time today for this academic session. And if I can now request everybody to move for dinner and drinks in the pre-functional area so that we can take these discussions on a more informal stage now. Thank you.